Bit of a rainy day, as you can see out there. Got a whole lot of washing to sort out. Gonna make a cup of tea. Gonna tidy up. Just finished vacuuming my car, so it's actually been not a terribly unproductive day. But yeah, come spend this little rainy afternoon with me while we chat about some stuff. Just been for a little walk. Hence the scarf. I don't think I've worn a scarf all year, so there you go. But let's chat about a few different things today. We're going to talk about different trajectories in medicine. Should you locum? Should you take a year off? Have I decided to do the right specialty? Am I completely lost and have no idea what direction to take? Who knows? A lot to think about when you start working as a doctor, and then you can figure out which direction to go in, but a lot of second guessing as well. So we'll dive right into that, see how we go. All right. Also had to change the hoodie because it was a little bit dirty, but we've got on some nice warm clothes, which is good. So let's just first start by saying that, like, you've done a pretty good job if you are listening to this and you are in medicine and you are working currently as a doctor. You've done an insane job already. So I think that's one thing to just be like proud of. And I guess it's not bad to be like okay with that and just do that for a little bit. I think a lot of people, by nature, doctors essentially, are very, type A personalities. They're high achievers. They're people who want to continually be moving forward and maybe a little bit hard on themselves and can get frustrated if they're not seen to be achieving and moving forward ahead of others or something like that. I don't know if that sort of makes sense, but a lot of people think like that. The thing is, like, medicine is like a 24/7 sort of career. You can spend, 24 hours a day, 7 days a week, 365 days a year doing this and still have more to give. And it can take from you absolutely everything, but you need to set like your own boundaries and like figure out what you want to get out of medicine and how it sort of looks for you in the big picture of things. And that's like a big thing about choosing like your specialty. Like, should you do something that gives you a weekend off every single week? Should you do something that may actually need you to wake up at 3 a.m. and come in to do an emergency operation? Is that something you'd be okay with, or would you absolutely hate that and never want to ever do that? Maybe it's be on call every second night because you're in a rural town and you're the only like specialist for whatever surgical specialty you are in, and there's no other way you can do that career without having those on-call requirements. I think it's like figuring out what the long-term play is, and then you can work out where to go and where to take that interest that you have that made you decide to do that specialty in the first place. You may actually be in this place of like a lot of indecision and not really knowing if you've made the right call, or you've sort of showed to others that you have an interest in, say, cardiology, but then you're like, do I actually like cardiology? Did I just like the people that were in cardiology? Have I signed myself up to do too much stuff, and now I'm like second guessing like my decisions to do that, and how can I get out of that, or how can I figure out what I actually like and what I don't like? And it's hard to say. Like, I mean, I don't think everyone can decide what specialty they want to do by doing each specialty and actually testing it out in real life. That would take an eternity. Like, if I needed to decide if I wanted to do pathology or not, I'm not going to go and be a pathologist for a little bit or work in a pathology rotation. I can just like decide that, you know, by a different way. Do I actually like pathology? Would this interest me? You know, have I seen pathologists at work? Do I like what they do? Do I not like what they do? And then go from there. If I was really undecided and thought that I was really considering it, then I could probably do a pathology rotation or get involved in the department in some way or another. But most of the time, you can figure out what specialty might interest you without actually doing the rotation itself. So that's a tricky thing, but I think that's one thing to consider, because if you're constantly like, oh, I have never done a neurosurge rotation, I've never done an ophthalmology rotation, how do I know? I might not fall in love with it. Well, you could do every single rotation and figure that out that way, but that's going to take you almost 20 years or whatever, or like probably not 20 years, but it's going to take you like a long time to do every single rotation. And even then, you're only doing that rotation from a certain person's point of view. So you might only be able to do a resident rotation in that particular specialty, and you're only getting a sample of what the perspective is from that point of view. I think one thing that a lot of people do, I know, like what, I'm 3 years into being a doctor. A lot of people in my year, even the year before or this year as well, have decided to do locuming. So what locuming is, if you've never heard of it before, is essentially you're like a contractor. You're like a contract doctor for different health services. So you get in touch with like a locum agency, and then what they do is they find you work for particular health services, and then you do whatever you're contracted to do. So it might be, say, 2 weeks of being a surgical registrar at X hospital in Queensland. And then you go up there to Queensland. They are usually pretty good and sort out your accommodation, they sort out your travel, they, do all that sort of stuff. And then you go ahead, do the shift, and then after the 2 weeks, then you're done. You're no longer like contractually, why am I having such a hard time saying contractually? But yeah, you don't actually have to work for them any more than that allocated time. So if it's like a 2-week period or a 1-month period, or maybe it's like a 3-month period, it just depends whatever you're contracted to. You do that and then you move on, and you maybe do a different contract at a different hospital, and then you go on from there. And they usually pay pretty good rates. So locum rates are usually pretty good, in the range of, say, it depends what position as well, but I've seen, say, registrar positions go up to, say, $180 or $200 an hour, which is absolutely insane. That's honestly like 4 or 5 times the usual hourly rate that a lot of surgical registrars, work at on full-time contracts. The trade-off is full-time, expected employment versus just short snippets of employment. So yeah, you could potentially do full-time locuming, but I don't know if it's the best security thing, and you're not connected to any health service, you're just a contract worker. So yeah, a lot to think about. All right, I think it's coffee time. Yeah, maybe coffee time, not tea time. I need a coffee. I'm gonna fall asleep otherwise. So ignore this mess. We're gonna clean this all up. But a lot of people that I've worked with, as I was saying, have started doing locuming, and or they've just they've been doing locuming this year, or they have done locuming in the past. I think everyone to some extent will need to do it. It's like, you don't need to do locuming. I think it is a bit of fun, and you actually get to explore a whole lot of stuff, and whether that be a different country, a different state. Usually people locum in the same country, so I know Australia or New Zealand, you would locum in, and you essentially just, as I said, sign up to a locum agency and go travel, and you might spend 3 weeks in New Zealand, and then you spend a week traveling, and then you do another 3 weeks working, and then a week traveling after that. It's pretty cool, pretty fun. Nursing has the same sort of like arrangement, and that's like agency nursing, and that's essentially like locuming but for nurses. They get to travel around, they get to, explore different places, work at pretty good rates, and then leave and go to somewhere else. And usually with all the accommodation and travel expenses all sorted out for you, it actually makes your life pretty easy. And if you did a full year of locuming, you could actually end up making quite a bit of money, and you could save for whatever. I think that's a really good benefit of the whole medical profession, is that you can actually work more because there's so much work out there. And I mean, my emails are constantly bombarded for locum agencies that I might have shown a little bit of interest in initially and sent my email to them, and they're constantly emailing me being like, well, look at all these shifts that are available. We've got this shift for like, $200 an hour. We've got it for 3 months contract. They might email me and just say, oh, we've got this shift. It's like $180 an hour. We've got 6 weeks of it. It's going to be in this place. It's, travel and accommodation is all sorted. Just let me know when you can start. And there's like 10 or 20 of those different offers pretty much every single day. Like, it's crazy how much work is out there for doctors. And I actually haven't seen like how much agency nurses get offered, or if there's lots of work or if there's not much work. I assume it'd probably be pretty similar, if not more, because there's definitely a need for more nurses than there are doctors. Because just by the nature of the medical profession, a doctor can look after, say, 15, 20, 30 patients, whereas nursing is usually like 1 to 4, or nurses usually have a smaller ratio of patients they can look after. And for some nurses, depending on the patient and the specialty and the ward and the, acuity of the actual patient and the bed they're looking after, but it might actually just be 1-to-1. So yeah, lots of things to consider for that. But I guess it's kind of tricky to know if you should, take a year off, or if you should locum or not locum. Lot to consider. So I don't think there's a real negative of locuming. If you wanted to do it, you should probably just do it, Like the worst case scenario is you get to the end of your medical training and you're like, oh, I wish I did this, or if I wish I tried that, Like, you want to explore all the cool stuff there is to do with being a doctor and not really have many regrets, but then also not like burn your bridges or shoot yourself in the foot. I mean, if you have momentum and you're going in the direction of doing a certain specialty, you want to keep that up. And if it is doing research or getting a job for the next year, maybe that's probably not a good idea to start locuming. If you want to impress those people, get good references and keep up your momentum in that sort of specialty, So it's like, it's a bit of a double-edged sword, because you want to travel and you want to explore and you want to take some time off. I mean, from my point of view, I'm thinking about doing this for next year in a slightly different way. I mean, my main goal is to do lots of research and take a bit of time off the clinical aspect, because that actually fills up a lot of your time. And if you're always like working like a 9 to 5, 7 days a week, or 5 days a week, then in your time off you don't actually want to do a lot of that other stuff, or you actually need a break, is the better way of saying it. So you are working all day, and then after work, you have to come home and do all that stuff all over again. And it's kind of tricky, because if you're not balanced, you can feel like burnt out and you feel like, a little bit stale. And if you just take all that clinical stuff away, then you have your normal day to do all that extra stuff, whether it be research or volunteering or getting involved in some leadership programs or doing presentations or going to conferences, courses, etc. If you just have that as like your goal for that year, then you can actually tick off a whole lot of stuff. Of course, you can burn the candle at both ends if you really don't want to take a year off, but I would put it to you that, is it the worst thing in the world? Like, is it so bad to take a little bit of time, take it easy? And it's not like you're taking your foot completely off the gas and not doing anything for that entire year, just sitting on a beach or, you know, just like watching movies and watching TV or playing video games. I mean, you're actually still doing stuff, but you're doing it at a more sustainable rate that actually encourages longevity in the specialty or in the, you know, career of medicine. So think about it like that. I mean, you don't always have to think about it like, I need to work 120% to get the job done. I just need to like figure out a routine that would work for me, and I want to get stuff done, but not feel completely like burnt out and exhausted and, you know, spent all the time. So have an idea about how you can actually do some specialty or some area in medicine that you're interested in, whilst also achieving like the things that you want to do in life. I was just chatting to this GP, well, soon to be GP, in a recent podcast on my Doctor's Journey podcast. And that conversation was pretty interesting because the person, Annika, was talking about how she had kids, she traveled, like she got married, she moved countries, all whilst fitting in medicine, albeit she is now like a PGY 10 or something, and there's a lot of stuff that could have been done earlier, but she decided to prioritize other things, and she still got into her specialty of choice. And that's super exciting to see that you can actually fit in your real life whilst doing medicine, and maybe some specialties are easier to balance it than others, but whilst you're doing your real life stuff, your stuff outside work, you can actually figure out how work fits into that. If that's your priority, you know, you might have a priority to be the best surgeon in, say, I don't know, ear, nose and throat surgery, and your goal is to be an absolute gunner and to get onto the training program as soon as you can, and anything that you know, inhibits that pathway is going to be put second or third or fourth in your priority list. So if you recognize that that's your priority strategy, then focus on that. But if you think your priority strategy is slightly different to that, then maybe it's worthwhile thinking about how you can actually make this fit in to your real life. And it's not such a bad idea if you do take a year off in locum, if you do take a year to decide what you actually want to do, and maybe you don't take that registrar position and put yourself under like enormous stress and pressure, but maybe it's like, I'll take a year and still be a resident and still have some time to do some other stuff and not be under so much pressure to get all this research and, you know, presentations and all this other stuff done. So yeah, coffee time. I think sometimes that there is a little bit of pressure self-imposed on people, especially in medicine, to get into a specialty, get onto a training program, start working as much as you can. And I don't know, if you take some time off or if you take it at a slower rate, maybe you're not achieving what you should be achieving, is the general consensus that I feel. So yeah, to do it slightly different or to take it at a bit of a slower pace is maybe a good consideration for people. And I think that if you're feeling like you're under the pump and you can't actually keep on, you know, doing this day in, day out, then maybe you need to really consider what you should give to medicine or what you actually want to get out of it, because otherwise it's going to really, really burn you out. And if you're constantly doing like 3 or 4 hours of overtime a day, it's not sustainable. You can't fit in like other stuff that you want to do. You want to have a family and you're like, how do I even fit in a kid in all this sort of thing, let alone a partner? Yeah, if you want to do a whole bunch of other stuff, then really work out what it is. And how this sort of fits into figuring out whether you've done the right specialty or not, or picked the right direction to go in for that specialty, is talking to a whole lot of people who in or around that area, and look at what they're doing. You know, are they enjoying themselves? Are they having time to spend with their family? Are they all single and have no kids, or really devoted to their life in medicine? Which isn't a bad thing, but if you want to do other stuff, then you need to weigh that sort of thing up. If it's a specialty where people actually have some time out of medicine to do their hobbies or see family or friends or travel, and that interests you, then maybe go to those specialties. Maybe it's a job that's outside of the hospital situation and that's what you're attracted to. Then go spend time doing those jobs and talking to those people, whether it be like outreach medicine or something like sports medicine or GP, or I don't know, like something that's like outside of the hospital system that is a little bit different to the general pace of things. Maybe that could be a bit more attractive to you. If you can talk to consultants in that area and actually ask some like real life questions about, you know, do they travel, you know, do they spend time with their family, what's your sort of everyday work week look like, then that would be a good idea to try to gauge if that would be a schedule that would fit in with your life, or you could see yourself doing for 20 or 30 years. Because I think that's what people don't really understand, is that, sure, I might be a resident this year and I might not like being a resident that much. And it might be slightly worse when I'm a registrar and have slightly less time, but you're only a registrar for a certain amount of time. And when you're on a training program, as long as you get all the stuff done, that might be a 5, 4, 6 year sort of period. After that, when you start working as a consultant, that's when your actual runway starts for medicine. If you don't like being a consultant in that area, then you've probably, you know, chosen the wrong specialty. But if you like being a consultant and you sort of didn't like being a registrar that much, that's okay. If you think like the consultant life would be pretty good, but the registrar life maybe not so good, that's actually not a reason to not do the specialty. I think registrar life in any specialty is going to be tricky. It's going to be taxing and it's going to be a lot of time commitment to get through. So it's okay to put up with a little bit of hard work or burning the candle at both ends for a short period of time, because in the end, you're actually going to get to where you want to be, and then you can actually figure out a schedule that you want to be. If it's just cruisy the whole time, I don't know if that's actually like a reasonable outcome for you. Like, if it's cruisy the whole time, then that's awesome, but I just don't think it's going to be like that. Every registrar that I've seen or spoken to at some point has actually been a little bit burnt out, a little bit exhausted, trying to do a whole lot of stuff, whether it be balancing on-call commitments to clinic, to theatre, to research, to presentations, to, you know, might be an M&M discussion or an audit that they have to present, as well as doing teaching requirements, and then also being like, you know, present in their actual life outside of work. Can be very tricky. So registrars are a unique position where I think that's where you're at your most exhausted and most like fragile sort of time. They're very busy, they're very like under pressure, and there's a lot of there's not a lot of time for them to actually enjoy a lot of stuff outside of medicine. Sure, you can make it work, but consultant life is probably where you get a good gauge of if it's a good balance or not with what you want to do and get out of medicine. So if the consultant life for that specialty is not something that you would be interested in, then that's where I would probably consider steering away from that area, because that's the thing that you're going to be doing for 20 or 30 years, potentially. So yeah, it's okay to look at a registrar in that specialty, talk to them, see that they're a little bit busy and under the pump, but realize that no matter what specialty you choose, some more than others, I get that, but largely no matter what specialty you choose, the registrar life is going to be very busy and very under the pump. So where do you go from here? I think it's okay to not know where you want to go in medicine, the things that I would do is hang out with people that you enjoy hanging out with, doing stuff that you enjoy doing, and go into areas that you're actually interested in and can see potential for growth. And whether that is, say, that they're developing new procedures and you think that this could be really cool to get really good at that procedure, and you could see yourself doing that over and over again and like really becoming an advocate for that area, for that specialty. Maybe that's like an area to like get your foot in the door and work under that consultant, because that's going to like extremely elevate those skills for you to get into that specialty and have like a unique skill set that is actually employable. And if you think about like how health services operate, if there's a certain procedure that's being done by 3 consultants in that health service, and they're like pretty newish consultants, maybe 5-10 years into their training, they've still got like 15-20 years left at least before they want to start employing someone different if there's no expansion of that health service. So if there's not too many specialists who are doing, say, I don't know, pediatric gastroenterology, or maybe it's like, I don't know, maybe there's no one doing like pediatric neurosurgery. Yeah, maybe there's not really like a lot of endocrinologists in that hospital, or potentially there are a lot of older consultants in that certain specialty. Maybe it might be a good idea, if you really consider working in that hospital or health service, to go into that specialty, because they need to supply that, they need to supply that job. So maybe that's thinking too far along the lines, but have a look at how many people are going into that area, and if there's a lot of need or demand for it. Potentially you might need to move states or find a job in a different area or location. It is going to be limited by how much work there is and if there are already people in that role or not. So you can't just expect to push out consultants who are like 15 years in, who are actually very good at their job, to make way completely for like a junior consultant. So yeah, it will depend on the work that is available and how you can actually see yourself setting up potentially private practice as well, So like a lot of factors to consider with like the long-term play for that area. It's not enough to think, oh, I like doing this, maybe I just keep doing it. When you figure out what area that you want to go into, niche down even further is probably a good consideration, because then I think just medicine's getting more and more niche, and if you want a certain procedure, you're just going to go to the expert in that procedure. So you're not going to go to a generalist who could do A, B, and C. And I was listening to like a podcast a couple of weeks ago, and I mean, there's a lot of people who can go out to the country and learn a lot of different skills, and potentially there might be like, I think there was, what were they talking about? There was some general surgeon who, the podcaster was talking about a general surgeon who they met or they heard of or they worked with, and they had seen enough C-sections that they could potentially perform one as a general surgeon. But legally and medico-legally, they would never do such a thing. But it's interesting to see that like they could potentially do that procedure as a different specialty. But it's like, I don't know if that's ever going to happen. Like if I know a lot about orthopedics and I'm in a different specialty, I'm still going to ask orthopedics for their opinion and their advice and just do whatever they say if one of the patients that's under my care needs an orthopedic opinion or has an orthopedic issue. So is it like, how beneficial is it to know how to solve everything in orthopedic land if you're never actually going to act on it? And there's an argument to say, well, you need to know a lot about a different specialty in order to have some idea about how to consult them, how to recognize those issues. And sure, that's true to an extent, but what about if it's like, do I think that it's this or that, or do I think they'll need this operation or that operation? I just leave it up to them, and then they can decide what they want to do with the patient. So yeah, I'm not going to be a hero and start solving orthopedic problems, because I don't have the expertise in that area. I'm not practicing it day in, day out. And even if I do or have done that in the past, I still can't, because medico-legally I need to involve that specialty, because that's the issue that they look after in that health service. So I think once you have an idea about what specialty that it is that you want to go into, really go all in and really trying to, figure out what your place looks like in that specialty, because there are subspecialties. There's, for instance, general surgery, but then under that branch of general surgery, there are people who do, colorectal. There are people who do breast and endocrine surgery, or there's people who do like upper GI or like hepatobiliary surgery. So all of those people can still do basic general surgery operations like taking out an appendix or taking out a gallbladder, but some people would specialize in, say, I don't know, hernias, or maybe it's like a particular type of upper gastrointestinal procedure that is like a Whipple's procedure, or some sort of like procedure like gastric bypass or something like that. So you can really niche down even if you're interested in a certain branch of a specialty, but you sort of have to be able to do just general stuff as well. I think the long and the short of it is that if you want to take a year off and figure out what you want to do and explore and travel, don't be afraid to do that, because I think it's a pretty good idea to do it while you're able to, while you're single, while you don't have kids, a family, you don't have any like long-term commitments. You can actually still dedicate a lot of time to be able to explore your interests, and you'll probably never have another time like that if people are being completely honest. So whether it is you just step aside, take your foot off the gas, but I guess what people have done in these years where they do like a locum year or research year or something like that, they have specific things that they want to accomplish. Whether that be, I want to start doing a master's, I want to do a diploma, I want to do a couple of research papers or whatever. They don't like sit down and do absolutely nothing for, the whole year. They might travel for a bit, they might locum for a bit, but they might also tick off some general thing that they need to accomplish to try to get into the specialty that they're trying to get into, or figuring out what specialty they want to get into. So whether it is trying to do some work experience or some sort of, research or audit involvement in the Department of Anesthetics, or trying to learn a different skill in that area, or help, do some private assisting, or helping out with, some data collection or something that they might need. As long as you keep your finger on the pulse, I think you still maintain a good degree of progression, which suits that type A personality who is always wanting to achieve and get stuff done and feel like they're not being left behind. And that's not a bad thing, it's just how you frame it is how you can actually enjoy that year, whilst not thinking that you're wasting time or not making the most of it. So if you want to locum. If you want to change the specialty that you're doing, then you can change the specialty that you're doing. You have my permission. I mean, not that you needed my permission at all, but it can be a sigh of relief to hear that from someone who may have always identified themselves as, say, an orthopedic person or a general surgery sort of person. Think about what it looks like in a consultant position, and would I like doing that at the end of the day, or would I not like doing that at the end of the day? And if you look at your specialty choice based on the consultancy runway and really compare that to other consultancy runways, potentially like a GP versus surgeon versus a physician versus like an emergency physician, there's a lot of different like roadmaps that you can go on. And Obviously, there's different variations in those specialties. Not all general surgeons' roadmaps look the same, and there can be people who work like a dog 7 days a week and they really love that, or there could be people who really take it easy and only work like 3 or 4 days a week, and that's fine. So look at what it could be for you and make it work. And you will have to grind to get into that training program, and then when you're on that training program, you will also have to grind, but everyone's doing that, so that shouldn't be a deterring factor. Work out what it's like at the end of the road. Of course, it's going to be tricky to get there. Some, it's going to be easier to get there than others, but it's not the worst thing in the world to try a little bit hard. It's not the worst thing in the world to really grind for a few years in order to get there, if that's what you want to do at the end of the day. But other than that, apart from listening to this, talk to people who are in your area, who know you, who know your skills, know your strengths, what you're good at, what you're not good at, who are actually honest with you in regards to that. And then you'll figure out something that's probably pretty good for you. That's it. There's nothing else more to it. Don't overcomplicate it. Work out what you're good at and what you like doing, and then do that. That's what I did. That's how I got into this whole thing in the first place. So I didn't overcomplicate it, but just stick to those things, and yeah, you figure out something that works for you. Rest of this coffee is going to get drunk now. All right, we'll see you guys next time. If you have any other topics that you want me to cover or talk about, let me know. Leave a comment. Otherwise, I'll keep thinking of some stuff and keep talking. Bye.